Morning, student. So, welcome to the second part of childhood trauma. In this part, we are going to understand the impact of childhood trauma and how to manage childhood trauma. Okay, so let's start. Okay, impact of childhood trauma. Now, we are going to discuss the impact of trauma on child behavior, relationship, emotion, feelings, his social development, physical development. Okay, so first is increase in risks of mental health disorder. Childhood trauma increase the risks of depression, anxiety, and insecurity. Yes, it increases the risks of depression, anxiety, and insecurity because trauma, that traumatic experience, attack the psychological power of that child. Then trauma contribute to difficulty in managing intense feeling like fear, anxiety, and or anger. Fear, anger, एंजाइटी, इनसिक्योरिटी, ये फीलिंग आते हैं, इंटेंस फीलिंग होती है, इसे मैनेज करना भी आना चाहिए. सो ट्रॉमेटिक एक्सपीरियंस ऐसा इम्पैक्ट डालता है कि ये इस चाइल्ड इस ऐसे इंटेंस फीलिंग को मैनेज नहीं कर पाता, उसे डिफिकल्ट जाता है उसे मैनेज करना. ओके, इट कैन लीड टू लो सेल्फ एस्टीम, शेम, गिल्ट एंड नेगेटिव सेल्फ इमेज. ट्रॉमेटिक एक्सपीरियंस का सबसे डेंजरस इम्पैक्ट है निगेटिव सेल्फ इमेज. उसके माइंड में उसका जो इमेज होता है वो निगेटिव होता है, उसका जो कॉन्फिडेंस होता है वो निगेटिव होता है, वो खुद को रिस्पॉन्सिबल डिसाइड करता है. उसे यही लगता है कि हाँ, ये ट्रॉमेटिक एक्सपीरियंस या ट्रॉमेटिक इंसिडेंट है, इसके लिए who is responsible? He is responsible. That's why he is always in the feeling of guilt that create negative self-image. Trauma disturb the child ability to form relationship. उसका इमेज नेगेटिव होता है, सेल्फ कॉन्फिडेंस भी कम होता है, हमेशा गिल्ट में रहता है. देन हाउ कैन ही फॉर्म relationship with society, or how can he develop social development, how can he interact with people? No. So his negative self image, negative self confidence, always in the feeling of guilt, disturb his ability to form interaction with people in society, that disturb his social development. Okay, then trauma increase the risk of हार्ट डिसीज, अस्थमा एंड स्ट्रोक. फिजिकल सिम्टम्स भी होते हैं, फिजिकली भी इम्पैक्ट, निगेटिव इम्पैक्ट गिरता है ट्रॉमा का, जैसे हार्ट डिसीज का रिस्क बढ़ जाना, अस्थमा, स्ट्रोक. ओके, बिकॉज फियर, जो फियर होता है वो ट्रॉमेटिक एक्सपीरियंस का जो फियर होता है, जो इनसिक्योरिटी होती है, दैट that is responsible for physical disorder also. Okay, children who experiences trauma may exhibit physical symptoms like headache, stomach aches, sleep disturbances, and changes in eating pattern. Okay, जो ट्रॉमेटिक एक्सपीरियंस होता है उसका फिजिकली निगेटिव इम्पैक्ट गिरता है, तो उसके सिम्टम्स क्या होते हैं? इंटेंस हेडेक, स्टमक एजेस, मीन्स कॉलेज अल्सर also, sleep disturbances. Okay, then changes in eating pattern, negative self image, negative self confidence, always in the feeling of guilt, can't form relationship with people, so he feel isolated, and that create negative impact on physical ability. So physical symptoms like headache, stomach aches, sleep disturbances, and changes in eating pattern happen. Okay, then trauma can hinder a child social and emotional development. Yes, because trauma has developed negative self image, and that's why the social and emotional development of that child is stopped. Okay, it has a negative impact on his social and emotional development, then impacting their ability to interact with other and manage the emotion. Yes, he can't manage intense emotion. Okay, fear, anger, anxiety. He find difficult to interact with other due to such traumatic experience. Now, how to manage childhood trauma? Okay, first understand that childhood trauma has lasting impact on your life. Yes, सभी बचपन में ऐसे ट्रॉमेटिक एक्सपीरियंसेस जाते हैं. So it is very important to understand that it is normal and it has long lasting impact on your life, and it okay, totally okay to feel that traumatic emotion. Okay, except that trauma happened and that you weren't responsible to it. Yes, जो गिल्ट का जो एक्सपीरियंस है या फीलिंग है उसे एलिमिनेट कीजिए. You are not responsible. You were not responsible to such traumatic experience. Okay, seeking support from your family, close one, friends, or from um, some psychologic psychological expert. Okay, open communication is very important. Express yourself to seek support from your parents, close ones. Then yes, living in present moment and self kindness. Be kind to yourself, be true to yourself, be genuine to yourself, and living in present moment is very important. Don't think about past. Don't uh, recollect the past memories. Okay, practice to enjoy your life, your time in present moment. Be kind to yourself. Identify the trigger and manage it next time. Yes, that traumatic experiences trigger you. So you have to identify the trigger, the source, and then next time you can manage it very effectively. Listen to your body. Yes, body speak. When such experiences you feel, then try to listen to your body, how it react. Then next time you can manage it effectively. And now the healing takes time and don't give up. Yes, it requires consistent effort and patience. So don't give up. Now conclusion. Now the final point is childhood trauma experiences like abuse and neglect. Yes, abuse, physical abuse, sexual abuse, verbal abuse. Neglect means from family isolation, family dispute, domestic violence, violence around society. Okay, has a lasting impact. Yes, on mental health, emotional and physical well-being. It is, you have to accept it. Then these negative experiences can disturb healthy development, leading to difficulty in social relationship and mental condition like insecurity, stress, anger, and depression. Yes, totally agree. The social development of that child get disturbed emotionally, physically. He get disturbed. Okay, it contribute to mental condition like insecurity, stress, anger, and depression. With appropriate support and therapy, individual can heal from trauma and develop resilience in life. Okay, trauma is a challenge, and resilience means bouncing back from that challenge. So, with appropriate support, consistent practicing, taking support from therapist, psychological expert, your family, and accept your trauma and try and practice to manage it, manage emotion, listen to your body, how your body react when you recollect the traumatic experiences, recollect the memory of that experience, that incident. Okay, so it is totally depend on you how you how you seek support from your family, in what way you manage your emotion, feeling, in what way you practice it. Self awareness is very important. Acceptance, self kindness is very important. Okay, so it was all about childhood trauma. Okay, we have divided childhood trauma into first part. In first part, what is childhood trauma? In second part, the impact of childhood trauma on physical health, mental health, and emotional health. Then how to manage it. So it is also, it is somehow connected to soft skill development because it develop resilience skill. Okay, so thank you very much. Take care and best of luck for your future.